Hey, what's up? I'm Dr. Atasha Jordan. Welcome to my YouTube channel. Thank you for checking it out. I am so glad that you found my page. I am a Christian psychiatry resident, and one of my biggest goals is to be able to share about Jesus and mental health. Honestly, the talk I gave recently was about spiritual health, mental health, and depression, and really helping Christians to be able to understand what that's all about. This talk in particular, this segment, it's about recognizing depression, and it's from a Christian perspective. It's about 15 minutes long, so I hope that you will kind of stick through to understand really all the signs and symptoms of what it's like to have clinical depression. That's really what I'm talking about in this video. You know, it's one of those things where I encourage you to watch through the whole video. If you have to put it on like 1.5x because you want to get through it a little bit more quickly, I totally understand. I definitely do that too with YouTube videos. But thanks for checking this out. I hope you enjoyed the video. Please feel free to share it with anyone who you think would benefit. Subscribe to my channel if you haven't already. Give it a nice thumbs up, and feel free to check in the future for future videos. Oh yeah, totally forgot to mention a really important disclaimer. This video, it's meant to inform and to educate. It is not meant to treat or to diagnose. So what exactly is depression and how can we recognize it? This to me is probably one of the most important parts of this presentation, because sometimes we are experiencing, honestly, some of us might be experiencing depression and not even recognize it and just think, you know, if I keep praying, things will go away. But you actually might need some things in addition to prayer to help your depression to be able to improve. So what we have here is a list of some different signs and symptoms of depression. And I'll kind of list this all out, but then go into detail a little bit further on. So the Diagnostic and Statistic Manual of Mental Disorders is actually where this came from. And within psychiatry in particular, we use this handbook to be able to diagnose patients. So again, just like if you have diabetes, if you have high blood pressure, a primary care doctor is going to look at your blood pressure. If you're over 140 over 80, they're going to say you have high blood pressure, and that's the guideline that they're using. For diabetes, if your blood sugar, if your hemoglobin A1C is over 6%, they're going to say you have diabetes. So similarly, if you have a certain combination of these signs and symptoms, that's how psychiatrists are able to say you have depression and you might have major depressive disorder. So there's hopelessness, there's depressed mood, sleep changes, appetite changes, loss in interest in activities, decreased energy, difficulty concentrating, increased guilt, thoughts of suicide or self-harm, and slowed movement or slowed speech. So what I want to do is to actually go into these in a little bit more depth. So first, thinking about the emotional standpoint, because before what I said in mental health, it's the emotional and behavioral wellness that's impacted by our biology, neurology, the society, and environment. So on the emotional standpoint, hopelessness, depressed mood, these are probably the two of the most important things to think about if you feel like there's no hope, like there's something going on and you don't have any way of how you can come out of your current situation. That's the hopelessness. Depressed mood, that's where you're sad, you're unhappy and going and feeling that way for quite some time. And what that can actually lead to is then emotionally having a loss of interest in activities. So let's say you're someone who loves to cook, someone who likes to knit, or you like to travel, or any of these other things, but you find yourself physically unable to do it, which is out of character for yourself. Whether it's like, let's say you're reading, or even if you like to watch TV and you can't even get yourself to do those things, that's one of the signs that you might be suffering from depression. And I'll go into, again, detail later on to show exactly the combination that might be more worrisome than others, because you might just have one of these and it might not be full depression. You might just be in a depressed mood for a few days. And your spiritual health, that is you being able to be connected with God, connecting with other Christians, can help you to recover from that shorter period of a depressed mood. But if it goes on for more than 2 weeks, which is what I'll talk about later, then that's where, from a clinical standpoint, we start becoming concerned. And then obviously, if you're having any thoughts of suicide or self-harm, that's where the emotional side of things can truly become detrimental, and why this conversation for me is so incredibly important. Because if we brush this under the rug and try to say that it's just our faith that will allow us to come out of this, we are truly doing a disservice to others by setting them up to potentially end up in this place of wanting to hurt themselves and end their lives, which is obviously something that we want to be able to avoid. On the other hand, so then there's the behavioral changes that occur in depression. So we have changes to appetite. So that could be actually either eating more or eating less. Changes to sleep, again, that change could be sleeping more or sleeping less. Decreased energy. So like, let's say you're sleeping 14 hours a day and you still have no energy throughout the day. That's a sign. That is a sign that you might have depression, that you're just so sluggish despite however much sleep you're getting. Your body, the biology, the neurology is working in such a way that you're not able to function in the way that you had been before. Difficulty concentrating. So this could be at the level of in your workplace, you're not able to work for as many hours in a row or not be able to complete tasks as quickly. But it doesn't have to be that severe. It can even be in your own home environment. Like if, let's say you're someone who loves to read and you wake up in the morning and normally you can read 5 chapters of the Bible in the morning, but you find now all of a sudden it's taking you that same amount of time, but you're only getting through a few verses. So those are the subtle things that we want to make sure that we're thinking about for ourselves or for our spouses, children, friends, seeing these changes that might happen, and honestly can a lot of times be kind of subtle unless you're looking out for them. I think increased guilt is another one. So whether it's anything you're doing, like you feel like you're not able to do things right, another way that the behavioral side is impacted when it comes to depression. The last one here is thinking about reduced speech and physical movement. So what we call that is psychomotor retardation. Really just saying that, let's say, I need to mute somebody. Thank you very much. And so with the psychomotor retardation, we are thinking about this idea that your speech might be a lot slower than previously, or let's say you're like in the kitchen and you're like chopping things up and you're the one who's normally able to like go, 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 go. But now you find that just to be able to get into the kitchen, you're not able to do things as quickly, or taking out the trash is taking you that much longer. Just anything that you're doing regularly, you're doing it much more slowly. That's another sign that collectively points towards depression. So now what I want to do is to put that all back together and really think about how, as a psychiatrist, we diagnose depression. And specifically what I want to talk about is major depressive disorder. So here again, these are all of the symptoms that I kind of just outlined. And when we're thinking about depression, where it's beyond just, I'm in a funk, because everyone at some point has a funk, where you're not feeling that great, but then you're able to use your spiritual health to be able to overcome it. Some people can't do that. Some people, if let's say you have 5 or more of these symptoms, and one of them has to be the ones that are starred, so loss of interest or depressed mood, if you have 5 or more of these for 2 weeks or more, that's a clinical diagnosis of depression. And that's where we then get into the conversation that we need to go beyond faith. And I know that you might want to fight me on that, and we can have a conversation in the Q&A about that. But that for me clinically is where we go beyond just faith to bolster our faith with medication and with therapy, because when you're clinically depressed, our faith alone is not going to get you through that. And the reason why I'm able to so clearly say that is, I'm using things that are common, so diabetes and high blood pressure. If you are diagnosed with diabetes, you can't just go to Pastor Brian and ask him to help you. Pastor Brian's not going to be able to help you with your diabetes. You're going to take medication that the doctor prescribes, whether it's your metformin, your insulin, and those together with your spiritual faith and your spiritual health will help you to get better going forward. So I think I want us to just think about the fact that if you're clinically diagnosed or clinically experiencing depression, we're going to have to also think about the medication and therapy in addition to our faith and spiritual health to help us to achieve wellness. So one thing I actually want to talk about is the fact that in the US, depression is quite common. So 7% of adults in America have depression. So that's close to 1 in 10 people. So statistically speaking, in the group right now, we have 60 people here. There's a good chance that at least 1 or 2 people, if not at this very moment, at some point in their lives have struggled with depression. The important thing to recognize is depression is not necessarily lifelong. There are people who might have just one depressive episode. There's some people who have recurrent depression where they have multiple episodes over time. But ultimately, if you are someone who's connecting with care, with your primary care doctor or with a psychiatrist, you will be able to overcome your depression with medication, with therapy, and with your spiritual health. And the thing that's really interesting to think here is 65% of people who have depression will seek help from a professional. And that is, again, going to your primary care doctor, psychiatrist, even a psychologist. And what to me is a little scary here is by saying that 65% of people seek help, 35% of people are doing nothing. And my fear is that in this 35% of people, a lot of us might be Christians who are afraid to reach out to help. And the literature actually shows that Christians are more likely, and people of faith in general, but Christians are more likely to actually go to a religious leader. So go to a pastor, go to a counselor in the church when they're dealing with mental health issues than they are to actually go to a primary care doctor. And I think that it's actually incredibly important to be able to feel that you have that comfort level to go to your pastor or to the different leaders in your church when you're struggling with mental illness, but at the same time recognizing that that is not enough, that in addition to doing that, reaching out to medical professionals is incredibly important. So one of the things I want to talk about, because this is actually really important, is the risk factors, because when we're thinking about who could get, like, how do you end up being the 1 in 10 who ends up having depression? Just in general for mental illness, but especially for depression as well, there are a few major risk factors, and those are your genes, your biology, your environment, and your lifestyle. So genetically, you're thinking about, basically, you're stuck with your genetics. Your parents, they created you, their genes came together, and they created the roadmap for what your genetic makeup is. And based on whichever traits and proteins are expressed, you will be either more likely or less likely to experience depression. But then beyond that, then there's the biology. So I've been mentioning things like neurotransmitters and the different chemicals in the brain that function in such a way to make some people be more likely to have a good mood. If you're someone who has higher levels of serotonin, for instance, or norepinephrine's, or even just any of those protective factors, you may be able to just get through challenges in life a little bit more easily than someone who has fewer of those types of neurotransmitters. Our environment, so whether you've grown up in an environment where people are open to talking about these things, or where you've struggled financially or have difficulty finding food, or there's violence in your neighborhood, all of those actually kind of embed into our experience as humans and change our ability to cope with challenges that life brings us. Our lifestyle is another one. So if you have a bad diet, your diet actually is really an important factor in kind of changing some of the brain chemistry that you have. Exercise, substance use, all of these things in lifestyle choices can then impact our biology and how our brain is able to function at its optimal level. So all of these together, and it's not necessarily a way that we can quantify which is most important for a specific individual, but all of these combined can increase or decrease your chance of having depression. The other thing I actually really want to talk about as well is, first, on one hand, thinking about the severity of depression. So what's really interesting in that 1 in 10 percentage, or it's at the 7% actually, but of those people, about 2/3 of them have severe impairment. So going back to what I had talked about before, and I'll actually kind of jump back to that slide really quickly, severe impairment with these signs and symptoms. So whether that's like, some people will get to the point where they're not eating at all. So example I'll give is if you have an elderly person in your family, so someone who maybe, let's say, in their 80s and having depression, what that looks like, what I've seen in the hospital clinically, is someone literally might not eat at all. And their depression might cause them to lose 20, 30, 40 pounds. I just treated a lady who, she lost, I think it was about 40, 50 pounds because of her depression, because she was unable to eat, unmotivated, did not have the energy, all of those relating to her depression, physically impacting her and creating impairment. So for 2/3 of people who have depression, they have severe impairment. But then on the other side, on the right-hand side of the slide, you're seeing that of these people, only 44%, so that left side of the slide there, 44% are getting the optimal treatment that is recommended for depression. And that optimal treatment is seeing a health professional and medication and getting medication. And what I will say as a Christian is adding on to that, leaning on your spiritual supports to be able to help support and to help heal from depression. So I wanted to emphasize that because people are suffering, and if you are or someone you know has depression, I think one of the worst things that could happen is to suffer in silence, and recognizing that you're not alone. I think that for me is one of the things I really like to be able to emphasize is if you're experiencing this, you're not alone. But more important, that there are ways for us to be able to help and for you to truly be able to feel better. All right, y'all, if you made it to the end of this video, shout out to you. You are the real MVP, okay? No, you're helping yourself and you are helping your community because you have now informed yourself on what it looks like to have major depression. You have a better understanding, hopefully, but if you have remaining questions, drop them below. Let me know. Here to help. I'm definitely going to answer any questions that you have that obviously are within the scope of not being clinical care, but wanting to just make sure that you are able to recognize what depression looks like for you, and to know when to seek help from a mental health professional. So if you feel like the content of this video kind of resonates with you, you think that you might be experiencing some of these symptoms, you know someone else who might be experiencing the symptoms, I really encourage you to reach out to a medical provider, whether that is your primary care doctor, a psychiatrist, a psychologist, someone. And if you are feeling that you are in crisis, you can always reach out to 911, go to your local emergency department, and they would be able to help you through a mental health crisis. Much love, and I hope you enjoyed the video. If you haven't already, make sure that you subscribe below, you like, you share, do all of those great things to make sure that we get the word out, because we don't want Christians falling in that category of folks who are not getting treated for their major depressive disorder, because it's treatable just like any other illness. Yo, I forgot to mention, if you liking the sweater, you can buy it in the link down below. All right, thanks for the support, y'all.